I'm Dr. Beaker. Oh, it's you again. Oh, I have here that you're here to talk about gonorrhea. Oh, you're not having a good week, are you? Right, what can I tell you about gonorrhea? Well, gonorrhea is otherwise known as the clap. Transmission is, it's a bacterial infection of the genital area, rectum or throat, and it likes warm, moist places. It's transmitted through contact with the penis, vagina, mouth or anus. Ejaculation does not have to occur for gonorrhea to be transmitted. Please remember that. There does not need to be fluid exchange to catch gonorrhea, just exposure to the affected area is enough. And also, it affects the urethra and the cervix. There are mild to no symptoms. Possible symptoms could be vaginal discharge, pelvic pain, pain when weeing. Sometimes pain when weeing is mistaken for bladder infections or vaginal infections. So be aware of that one too. If symptoms occur, they will usually be between 2 to 10 days after infection, and you could have bleeding between periods. If you have an infection in your rectum, the symptoms are bleeding or pain as well as discharge from that area. Symptoms of gonorrhea infection in your throat could be mistakenly diagnosed as strep throat. You need to have regular sexual health checks if you're younger than 25, which we know that you are, or if you have different partners, which we know that you do. You will have a swab done from your cervix or the infected area, and it will be sent to the lab, which will be gram stained. Do you understand about gram stains? Yes? Oh, you've done science this year. Oh, last year. Oh, that's good. So you understand about gram staining. If you have an infection, you'll be treated with antibiotics or an injection. Even though there are more drug-resistant strains of gonorrhea popping up over the years, this makes treatment harder, but we'll get there. If you use antibiotics and are on the pill, remember again, you need to use condoms as you may still get pregnant. You do need to abstain from sex or use condoms, as I have previously mentioned, and your partner needs to be checked as well. As with the other sexually transmitted diseases I've mentioned, gonorrhea affects the reproductive areas and also the mouth, throat and eyes. If untreated, again, it can cause PID. You remember what that is? Yes? Good. And internal abscesses. If pregnant women are exposed to gonorrhea, the infection can be passed onto the child at delivery and cause blindness, joint infections or a life-threatening blood infection. Treatment is needed immediately if gonorrhea is found in pregnancy. Is that all? Is there any more infections you have that you'd like to talk about? No? Okay, well, thank you for coming, and just remember one bit of advice from today: use condoms.